Good morning, everybody. This is the Board of Health meeting for Monday, June 22nd. This is a virtual meeting, so therefore all votes will be verbally acknowledged. 10:30 a.m. and everyone is present. First business is to make approval of the minutes for May 18th.
Make a motion that we approve the minutes.
I second it.
All in favor?
Aye.
Joan, you have to say,
I said aye. I
Yeah.
have to say,
you have to say,
I said aye
okay.
twice.
Aye.
Three
So
times.
all in favor, aye, right?
Aye.
Okay. Approval of the minutes of June 2nd.
Make a motion that we approve the minutes of June 2nd.
And I second them.
All in favor?
Aye.
Okay. So now moving on, we are new business. We welcome Nicholas Crowenshield as our new public health nurse. And I have to have one of you make a motion to appoint him as the new public health nurse.
Does he really know what he's getting into? I make a motion that we approve his joining the group.
And I second it, is coming to the Board of Health.
All in favor?
Congratulations, Nicholas.
All in favor?
Aye.
Nicholas, you're approved. So welcome aboard. I know this is your second week already or third week. Which is it? Your microphone's not on.
No, he just had technical difficulty.
Can you hear me now?
Now we
Yes.
can hear you.
Okay, good. Thank you, everybody. Yes, this is my third week, starting my third week.
Welcome aboard. You're finding it. If you're finding your way around, even though it's virtual.
Absolutely.
Good. All right. So moving forward, old business. Sigal, do you want to update us on COVID-19?
Sure, and a lot of this does overlap with my director's report, but I thought in this section we could talk about the numbers.
Okay.
I did email some updated numbers this morning just to give you the latest and greatest. And of course now I just need to pull them up on my computer. So definitely seen a decrease in numbers. Just like we've seen across the state, definitely seeing that in Norwood also. I included the overall numbers, which are the total confirmed cases, which are 570. And then the confirmed cases we received last week was only 2. And again, these are tested confirmed cases. There's a whole nother category of cases called probable, which the total number that is 596. The reason why.
Excuse me, Sigal, what's the name of that? Troubled? I can't hear you.
Probable.
Probable.
There's laboratory confirmed,
Thank you.
and that means you had the nasal swab, the PCR test. And then there's probable, which means you either had an antibody test or you were diagnosed without an actual PCR test. But my point is that most of the state reports are confirmed cases, and that's why I just report out the confirmed. We do also investigate and deal with the probable cases. So, but it's the confirmed cases that we're really measuring to see the trend of the virus and what's going on. I also included the state numbers that they release every week on Wednesday. I included last Wednesday's numbers as an updated. Those also are looking good. Our percent positive number is going down, which is a good thing. Our rate of testing is actually higher when compared to the state. Our positivity rate is a little higher, but I always say the more you test, the more you're going to find, and that's a good thing. So you want to continue to test. So we're testing at a higher rate compared to the state, and our positivity rate is a little higher compared to the state.
So are we still doing our testing through the Norwood Hospital with our 1,000 that we got, that Tony got us?
Yeah, we still definitely offer that for residents, that they can call Norwood Hospital and get a test through the community testing program. To be honest, it's very low usage of it. Tests are pretty widely available at this point. So there's really no need, but we want to make sure we keep that open if we do need it in the future. It is available if residents need it.
Okay.
Gal,
Okay.
word, maybe you can help out the community a little bit, understanding that there's the press in saying that more young people from 25 to 35 are getting it. Is there, is there any truth to that, validity to that? I mean, are we more susceptible to the young kids now than the old kids because social distancing is not being observed enough?
I think there's a lot of unknown about this virus, and we don't know why younger people might be less susceptible. It might be that they show less symptoms, so we test less often, so we don't find those cases. Or it might, there's been some evidence that actually the receptors on the cells that the virus attaches to are less developed in younger people. So there's a lot we don't know about the age breakdown and why, but we do know that it definitely affects older people at a much higher percentage and more severe illness.
Okay, because you're reading so much about some NHL players, a lot of NFL players, and they're young, strong, healthy players. They may be asymptomatic and they hopefully can beat all this, but they're becoming very susceptible from social distancing or just because, like I said, the virus is tracking towards younger people now.
I'll say our case count tends to be older. We definitely do get people, our first highest category is 70 plus. With the overwhelming majority of our cases. Our second highest category is 30 to 39. And I would say
okay, so
those are probably our essential workers, the people that have been working. That's over the whole history of the case counts in Norwood, at the beginning of March. But
that's interesting.
Besides that,
30 to 39.
30 to 39 range, it definitely increases from 0 to 9, and it slowly increases up until 70. So I'm talking about when I mean increases our case count by age group. And I do every week on the town website, break it down by gender, age, and rate.
Thank you, Scott.
I can do my report here, or I could save it for my place on the agenda, but I can talk about all the activities we've been doing. At this point in the agenda, I was hoping to just talk about the numbers, and then I can get into more details about what we've been doing with our restaurants and indoor, outdoor dining and all that. Is that all right?
Yeah, we'll move on to your regular report. All right.
Okay.
Bless you.
All right. So, Aubrey, you're up. Impact Norwood program.
Yes. So good morning, everybody. It's nice to see all of you.
Nice to
So over the past few months, we've been hosting a number of webinars just to help the community cope with the COVID-19 pandemic. They've ranged from helping parents raise their teens in a really difficult time to how food impacts your mood. And the goal of all of those webinars is to just promote positive mental health and positive coping strategies. So in the end, we hopefully reduce the risk of substance misuse. And all of our webinar recordings are available on the Impact Norwood website. So that's at impactnorwood.org. So if you missed one, you're able to watch all of them on our website. On June 11th, we actually had a really exciting webinar with a former 5-time Olympian and gold medalist, Keegan Randall. She's kind of a pioneer in cross-country skiing. So that was amazing. She shared her story with our community and gave participants like practical tips to cope with unknown and uncertain times. She's actually a cancer survivor as well, so she knows what it's like to live in the unknown. So that was really helpful. Trying to think what else. Our youth coalition has continued to meet amidst the pandemic. Mostly we've just been checking in with one another to make sure we're all doing okay. But as our schoolwork winds down, we're going to begin a positive community norms campaign. So highlighting the positive actual behavior and hopefully reducing the misperceptions of unhealthy behavior. So for example, A lot of people might assume that all teenagers drink or use marijuana, when in reality, the majority of them are not. The majority are making healthy decisions. So we're going to start a campaign to promote that. And then coming up in the fall, we're getting ready to implement the Metro West Youth Health Survey again, just to collect that data and see what the trends are around substance use and other behaviors. So we've been plugging along.
You got any feedback from the community? Has anybody giving you?
About the webinars?
Yeah, about us or any suggestions for future webinars, etc.
Yeah, so we before we actually started hosting the webinars, we put a survey out to the community to find out what they wanted. So everything that we've been doing has been a result of that survey and the results that we got from that survey. So, and I've heard from people after that they've appreciated and are thankful for the work that we've been doing. So,
Oh, great.
Yeah.
Good job. Angela, you're up. We're going to hit the
Thank you, Aubrey.
new food establishment report.
Sure, we'll start with the report. We have as good as it gets on the list here. They've been open for several months now. Sire Market is a supermarket that is open next to Launch Trampoline on Route 1. They've been open as well for several months.
Next to
They
what?
were open before the pandemic hit.
Ne-
Next to Launch
what?
Trampoline.
Oh, okay, okay.
Cousins Maine Lobster is a food truck that was inspected and permitted several weeks ago. I know they'll be visiting the breweries in town, I believe on weekends. On the bottom there, where it says pending, one of the establishments was permitted on Friday pending the installation of a garbage grinder that is Norwood Golden Bull. They are a shop on Washington Street. So once they install the garbage grinder, I would be going out, verifying it, and then giving the permit to operate.
Do we have a permit, Angelo, for Bowl Boys?
They did contact us. They filled out the paperwork. I haven't seen the paperwork come to my desk yet. But they said they were going to renew for the year. I'm not sure what that
Okay.
stands as of yet.
Okay, because they are still working out there.
Oh, okay. All right.
Angela,
Go ahead.
I'm sorry, Mr. Chairman. Angela, when the lobster trucks and the trucks go around, are they required, like the ice cream trucks, to have two people in them? You know, when the ice cream truck used to go to the playground for safety, remember we voted that they had to have two people on those trucks at all times? For safety, for
That I
sexual
thought was
harassment?
just for the ice cream trucks, which they.
Okay,
currently-
but no,
Well,
I'm
they do
wondering
for
if
the
that
ice
rule
cream
follows for them. So two
Not for the
should be
food
in that truck?
trucks themselves.
Not for the
Not for
food
food
trucks.
There usually is
Okay.
there's usually at least two on the food trucks. For
Okay.
sure. But I don't think
I
that's a
just wanted to
requirement
know.
for food trucks, just for ice cream trucks.
Okay, thank you.
So that leaves my
You're welcome.
question.
There's a bit of a delay, so I apologize if we're stepping on each other here.
That's okay. Do we have food trucks that have gotten their licenses?
I'm sorry, can you repeat that?
Food trucks.
Ice cream trucks? Not as of yet. I have not permitted an ice cream truck this season yet.
Well, there've been two in my neighborhood, so I already had one stopped by Officer Bishop because he was coming into my house, and he stopped her because she only had one person in the truck. We told her to contact you. I don't know the name of her company, but I also know that Pelagi Brothers has been out there as well. So none of them have. Okay. Well, I do,
Follow up with
because I live on Father Mac Street. and they go down to the playground. So if I do see them, I will go down and tell them to get in contact with you, and they can't sell until they contact you. Correct?
Sure. And I will follow up with Bowl Boys. I will follow up with the Pelagi's ice cream truck as well today.
Okay.
Yeah, I guess Bull Boys has been down, in Industrial Way. They
Okay.
used to be at the DFW, but now, and don't tell them it was me because my granddaughter will hate me. She loves their bowls.
Right. Great. Any other questions on the new food establishment report?
Thank you.
No?
Good, great.
So we're gonna move on to the inspection report now.
Yes, as you can see from the inspection report packet here, a lot of it, the majority of my time is spent on conducting lots of pandemic-related enforcement in regards to complaint investigation, site visits, education as well. When I say education, I mean discussing the new standards with the food operators during my site visits as well. We also got a lot of applications for pools. I can discuss that later after the food report. But that's basically what's been going on. As you can see from the inspection reports here, I'm hoping to get back out in the field and consistently conduct these routine inspections, hopefully starting this week. When I do my routine inspections, I will also look for, pandemic-related enforcement issues as well.
I have one quick question to Stan Angelo. I read through the CDC guidelines and several restaurants have contacted me. They all have their new sprays that kill the virus very quickly on contact. But I told them to use paper towels instead of a reusable cloth. Is there a law on that? When they wipe the tables, I say use paper towels so you can throw them away instead of going to a bucket filled with, bleach and then wipe the table down again. I mean, am I wrong? I don't want to.
So with disinfectants are only supposed to be used on non-food contact surfaces such as tables and chairs. I know some of them require some contact time, meaning spray, wait 30 seconds, and
That's
then
right,
wipe it
yeah.
down. Yes. So
But can we
paper
wipe it
towels
down with
would be
paper
recommended.
towels instead of a cloth that goes back in a
Yes.
bucket? My question is it safer to use the paper towels?
I strongly recommend that paper towels are used, so they can be used once, obviously, and disposed of.
That's what I mean.
So I
One
would
time
recommend
use, throw it away.
towels, yes,
Okay, thank you.
yes.
Quick question for you, Angelo. As far as signage, are all places required to have a sign that says masks must be worn?
So what I've done, I've dropped off about 50 signs to 50 different locations in town. A lot of them already had signs posted. It's recommended, I don't know if it's a requirement, but all the places I visited do have them. If they
Okay.
did not have them, I gave them a copy of RSA that they posted at the entrance of their establishment. They do have signs also indoors that they've made up for customers as a reminder about social distancing and the face covering requirement as well.
Because a mobile gas station on Route 1, I had somebody calling me about that. The one that's on the same side of the street as Yankee Spirits there, that
Yes.
behind the counter was wearing a mask, but they are not requiring their customers to wear masks in the store.
Okay.
And basically, he told the woman who asked the people that were in the store why they didn't have masks on. He told her that they're not requiring their customers because they'll lose them as customers if they don't wear masks. She basically told him, well, you'll lose me as a customer because they're not wearing masks, and they shouldn't.
Yeah, I'll follow up with them. I believe that's the golf gas station. Is that correct? Right before you.
It's on the same side of it's right at Dean and Route 1, on the same side of the street as Yankee Spirits. I'm not sure, the mobile or golf.
Correct.
Yeah.
That's a golf. I'll follow up with them. It's a golf. No problem. Absolutely.
Plus, she said she encountered
Do you-
people that were from Pathfinder Tree that were in there, and they said they're from New Hampshire, they don't have to wear masks. She said, well, you're in Massachusetts, you have to wear them.
Right.
So just,
And They were one of the locations where they were given a sign to post at the front door.
Yeah,
At
they
the-
haven't.
I know they do have it posted, so I'll make sure they're enforcing, they enforce it as well.
Great, thank you. Anyone else? John, do you have any issues?
No, it seems like that the complaints are not really complaints, it's just reviewing any problem, with the masks and whatnot. And he's gone through the people with complaints and taken care of them, so I don't see any major criticals on any of them. So have you,
Neither do I.
Angelo, any major criticals anywhere? Angelo? Hello,
Have I?
Angelo?
Yeah, sorry, this is, again, there's a delay, but, no major compliant issues in regards to outdoor dining area setups. No major issues. Again, I give them a copy of the standards. They usually have them in their hands when I arrive. And we just briefly discuss what some of the standards are
Okay,
for restaurants regarding outdoor dining. So I visited most of the open places that have set up outdoor dining and are operating outdoor
Mhm.
dining. There are still some places that have submitted the application, they've been approved, but have not yet set up their outdoor dining location. So, so I'll be going out, visiting those locations, and when I'm out in the field.
okay, now, if they have outdoor dining now, and with, it's opened up today for, indoor dining, does that mean that you have to go around to all of those establishments that had the outdoor dining to make sure that everything is, can they can still have outdoor dining, am I right?
That's correct, yes. They still can have outdoor dining, indoor dining, they're allowed to have, providing that those tables are 6 feet apart, unless they have a barrier between the tables. So when I do my routine inspections, I will also look at their outdoor dining area if they have one, and make sure that they comply with all the standards that are in the guidelines from the state.
They have to have, things between the tables at 6 feet? They have to have,
So if they have barriers between tables, they do not have to be 6 feet apart. That's going to take a lot
okay.
of. Yeah, I think most places are going to have those tables 6 feet apart instead of installing barriers between tables.
Yeah, I could
Which
just
would be
see
time
shower
consuming.
curtains all over the place, yeah, okay.
Well, yeah, there's a cost to it, obviously. So I think a lot of them are just going to try their best to keep these tables 6 feet apart from each other inside.
Okay, and no bigger group than, is it 8 or 10 or at a table? No bigger groups than 8, did I hear?
I believe it's still
It's 6.
6, I believe.
Is it still 6? Okay. Okay,
Can we have gatherings of 20 in a group? Is that a part of this phase, Scott?
No, definitely not. No large gatherings, no events. You can only have seated groups of 6, maximum 6.
Okay, so no gatherings, no home
No.
gatherings still? No,
You don't want
okay.
people mingling, no people walking up to the bar. You come in, you're seated, you're served, and you leave. So no people wandering around, getting your drinks, mingling, none of that is allowed. And I just wanted to emphasize
thank
that indoor dining is allowed as of today, but we still want to encourage outdoor dining. So we're still going to work with places to get their outdoor dining set up because that's still safer. We can have people indoors and it because their capacity is limited indoors because they have to follow those spacing restrictions, that we do want to encourage them to continue to do the outdoor dining also.
oh, good.
So did you say something about air conditioning, Sigal? Should it be used? Should it not be used indoor dining? I was confused as I read the guidelines again, cross ventilation, keep the doors open, we're always keep the door closed because of the bugs for indoor dining. So now keep the doors open with the screen. And
Yeah.
what about the air conditioning?
Air conditioning is fine. You want to have a movement of air. You don't want to have, warm, dense air. Movement of air is good. Fresh air is always even better. The more you can get fresh air in, that's good.
Thank you.
Listen, I've been around to some of the ones that have been open, outdoor dining, and the people are loving it. I think it's going to be tough to have them go back inside because they really like being outside in the fresh air. The only drawback is if it pours rain, but other than that, at least now they have something. If it's pouring out, they can go in. But as far as I hear from people in this community, they're absolutely loving having the outdoor dining. So kudos
Right,
to
I
everyone
agree.
that going.
And I
Huge.
believe Kathy is doing that same kind of circulation as you do, that Angelo kind of tested this, that 95% of them have all their regulations right up to snuff. I mean, somebody might get up from their table without a mask on just because they forgot it to go to the bathroom. But I've been there and sat in several places, and I find them all, Angelo, very much in compliance.
Yeah. And people are
Which is, thank you.
people are very willing to put their masks on, even if you say, if they get up and they forget, they're very willing to put them back on, and they go, oh, I forgot. They put them back on. That I know of, there really haven't been a lot of complaints as far as that's concerned in the restaurants. I think people are enjoying being able to get outside a little easier. Now, back to social distancing, if you had a barbecue at your home, are you still limited to 6 people?
No, an outdoor event, you are limited by social distancing. You do want to make sure you're still social distancing if you have people outside. That's not a scheduled event. So you can't have a scheduled event. I'm trying to think of an example. So you can't have like a concert.
Okay.
But you are allowed to have private gatherings at your home.
Okay. Okay. That's good to know. People are concerned. They want to have a barbecue with family members, but they don't want to limit it to 6 people if they, you know what I'm saying? So that's good to know.
I think 4th of July is going to be a big problem, but you know, there's nothing you can do about people having cookouts and stuff on the 4th of July. Now, they're not having the parade this year, is that correct?
No activities.
Right, okay.
All right.
May I add something about
Sure.
May I add something about indoor dining?
Yes.
After the governor's announcement on Friday allowing indoor dining today, I spoke to about 3 owners of restaurants in town, and they are still not comfortable offering indoor dining, so they're going to keep their outdoor dining area as is and not allow indoor dining because they don't feel safe for whatever reason. Obviously, there's a couple of reasons. So if they want to do that, that's fine. If they want to not have indoor dining yet, that's up to them. But a lot of places are not comfortable with that as of yet.
Okay.
That's not a bad thing. It's okay.
No.
They'll make it, when they're more comfortable, they'll be good with it, so. All right, thank you, Angelo. Any other
you.
No, I'm good.
You from the director's report?
Sure, that's actually a great transition because I want to say the whole outdoor dining regulations and implementation was a great partnership between obviously our department, planning, economic development, and the selectmen's and the manager's office. And actually, let me expand that because they also have to get approval from building, fire, police, and I hope I'm not forgetting anybody. So great teamwork to get that up and rolling and get each one approved. I believe we have somewhere around 26 applications submitted, reviewed, and approved. So that was quite an accomplishment, and really want to congratulate the team for doing that. It wasn't easy, and it was a lot of time put in, but we wanted to make sure our restaurants were able to open when they could and do it in a safe way. So congratulations to everybody on that. Along those lines, we continue to work with our local businesses. We had a call with them on June 9th to go over more, not just restaurants, but all our business, go over the safety protocols for different the sector-specific protocols. And then I was also on a panel with the Neponset River Chamber of Commerce on the 17th, sort of expanded beyond Norwood, to talk with local businesses about the safety standards and the public health reasoning behind them. We're also working with the rec department to make sure their operations, both pools and camps, and eventually their building, make sure that they follow all the safety protocols. We're all going to have a walkthrough on Thursday, the 25th at the pool before it opens next week. Make sure everything's smooth there.
What time?
Thursday at 2. Then working with clerks and the town moderator and school facilities to plan out town meeting, which is tonight. So we're gonna social distancing. We're gonna be escorting people to their seats. We're gonna make sure that people waiting in line are separated the 6-foot distance. So a lot of activity around that to make sure we can do it in a safe way. So see how it goes tonight. I have been stressing the whole time that time is a factor. that, obviously we want to let the system of town meeting go, but we also need to keep an eye on the time. The less time we're in there together, the better.
Will you address that to the crowd when it starts to go, like we say, less is better as the time? Or just to give them a little heads up, or would you just let it go?
I stress.
I mean, we get there and say, the health.
Sorry, I have a little delay too. It's tough. Yes, I've stressed it with the moderator and with all the elected officials that sit up front. And it was communicated in the letter sent out to town meeting members.
Oh, good. Oh, didn't know there was a letter. I didn't know. Oh, great. Good. Thank you.
And then we are going to have a bunch of all our interns and our student volunteers there to help sort of manage the crowds too. I do expect most people to be compliant. Everybody sort of knows the rules about face coverings and social distancing, so it's just a matter of making sure people know where to go. But I expect it to run smoothly. And then we continue to do our contact tracing with our positive cases, isolating our cases and quarantining their close contact. We do continue to see cases in our nursing homes. We also are seeing, I talked about a little when I was talking about the numbers, the probable cases in addition to the confirmed cases. We talk a lot about testing, we talk a lot about contact tracing, and there's sort of a third leg to that stool, and that's supporting the cases that are in isolation and quarantine to make sure that they can be compliant. So, whether it be a grocery order or getting them medications or getting them, something for their family. So those three things are really important to stop the spread. We call it the testing, the tracing, and support with those wraparound services. I feel like we talk less about that, but it's just as important to ensure we get compliance.
How is the tracing going, Gal?
Yeah, it's going well. We do work with the State Community Tracing Collaborative to help with the caseload. When I report we get 1 or 2 cases a week, it doesn't mean that's our current caseload because cases can last for several weeks, some
Right.
for over a month. So we still have to follow those cases from previous weeks. So our caseload is not represented by the current confirmed cases that week. It actually goes back several weeks and maybe even longer of what we're monitoring and keeping track of.
Okay.
If the board had any other questions?
Nope.
On that, I have a question, but that's not time yet on that.
All right, so I guess moving right along the board's agenda. I want to congratulate Joan on being reelected.
Thank you very much.
Congratulations, Joan.
Thank you.
And
Congratulations, and I would like to congratulate Joan as well. We work very well together. It's a very tight board, and I think we worked well with our administrators through this very difficult time as it changes daily for Sigal and Stacy. It's very difficult. So we're here to support you, and we're grateful for what you brought forward for the town. I'm so proud, so proud to be a part of Norwood in this with all of you. That said, I would like to nominate Kathleen Bishop, who's done an outstanding job with this COVID crisis as well, for chairman.
And I would love to second it. We're happy to have you, Kathy. We truly
All
are.
in favor?
You did an
Aye.
amazing job.
There
Aye.
you go,
Well,
Kathleen. Congratulations.
Yes.
I don't know if Sigal agrees because this has been a tough year. We had, issues with the smoking ban and then
I
we
don't
had
think it's over.
so the
Yeah.
black cloud kind of hangs on for another year, I guess. Thank you.
Lucky you,
Thank
Kathy.
you. Thank you, Kathy.
Thanks. We don't have to
Okay,
take
we've been
Go
my
ahead.
forum. So out in the street last week, somebody came out to me who owns a convenience store and asked, Throwback Monday, to Sigal, ask about the cigarette. Has there been a change in law with cigarettes, with menthol cigarettes?
So there's a new state law that went into effect June 1st. It doesn't change anything in Norwood because we already did outlaw mint and menthol.
So
They're
we
not
outlawed, right, so we outlawed mint and menthol. Did the
Yes.
state law allow anything in like, regular cigarettes can just be plain menthol, no mint, no flavor, nothing.
No
Nothing.
products that are mint or menthol or wintergreen, anything like that. No vape products, no cigarettes, none of that is
So
allowed.
nothing has been changed with the law we put in place.
No.
Correct.
Angelo, oh, did he leave the room? It's all right. I'll talk to him privately. I'm all set with that. Thank you.
Joan, do you have anything on your agenda?
No, I don't. Angelo answered the questions and Segal answered the rest of them, so I'm fine with that.
And I basically have asked all the questions that I need to know. So I just want to thank everybody for all the hard work. Segal, Stacy, Aubrey, Angelo, you've all been, and Jen, of course, and now Nick.
And
You're on,
Nicholas, you're coming.
you'll be there. You'll get to know what work we do. So
Poor guy.
I'm sure they
Stacy.
keep you very.
Yeah.
Yeah, Joan.
Stacy, anything that you need to talk to us about?
Just, there will be some more changes to the guidance regarding testing
Yeah.
for COVID. So I think most people kind of, we all know that we don't know how long that you have some protection. So when you have antibodies, we don't know how long that provides protection. Like something with measles, we know you have long-time immunity. But since we do not know with COVID, they are going to change it. They're going to be very conservative and go with the number 6 weeks. So
Wow.
in other, if you were a case back in February, and all of a sudden whoever you live with, your husband, your wife, or another close contact becomes a case, you will have to go into quarantine.
Oh, boy. Okay.
Yeah. They're looking at the number 6 weeks. So Joan, for instance, if you were ill and then 2 weeks later, someone in your household becomes ill, you won't have to quarantine again because it was only 2 weeks ago. But if you were a case back in February and then someone in your household or close contact, someone you work with or someone you've been in close contact with, and that's within 6 feet, 15 minutes of conversation, that's considered that's considered a close contact for you, and you would have to go into quarantine for 2 weeks. So that's the new guidance going forward.
Wow.
Just because they are so, and it might change. Then they might say, oh, we discovered you really have 8 weeks, because the CDC is saying 6 to 8 weeks, and the state is going to take the real conservative view and go the 6 weeks. But then as we know more, we may determine that you have 3 months or 6 months of immunity. I was really hoping for like 6 months, but right now they're gonna go with the 6 weeks. So that's gonna be the next. So some of these cases are gonna be cycle. So we're gonna, I was kind of hoping the cases we did and they recovered and you had some immunity, I was hoping that they were gonna be back burner, but unfortunately we're gonna be seeing them come through again.
So you have to wait. If you get it, it's 6 weeks. And then I'm just trying to think of how often you could be quarantined, like.
You could be quarantined, yes. You could be, especially if you're in a high risk job or high risk setting, yeah.
Yeah, or you're in a large family and they get it one by one. Yeah.
Perfectly right. You have 6 kids or you have big household. Yeah. And that's
Okay.
why.
So Stacey, is that a contradiction? Okay, so is that a contradiction when Paul was quarantined and I wasn't? Would I then be quarantined now? Because I didn't have direct contact with that person, or only if he tested positive?
The person you're talking about, I don't believe was a case. The person you're talking about.
I'm just saying randomly now, I'm making up a fictitious one. I'm saying, so if my husband tested positive, I am now quarantined? Yes.
Yes.
Yeah,
That's always
you were
been.
never a
That's
case,
always
Carolyn,
been.
so you would anyway. I mean, not to disclose your medical, but I'm not, yeah, so let's use fictitious people, but yes, if.
Mickey Mouse. So if Mickey got it, would Mouse be,
Oh, jeez.
I think it's
Okay.
like 6 weeks out, Carolyn. So in other words, if Paul was positive and you got sick outside of 6 weeks, then he would have to quarantine. Correct?
boy. Okay, so with these new changes, Segal and Stacy, That was my next question. I flipped the page. You're working very closely, I hope, with the school department, because I understand that every town is responsible for whether our kids are going back to school or not, right? Sgal?
Yeah, it's a
Yes.
local decision, but I do expect guidance coming from DESI on that for the schools.
Oh, you do? Okay. So, but you will work with the superintendent and he will follow your recommendation.
Yeah, we usually make a joint decision, just like we did to close down. I still connect with the schools, the superintendent and the chair of the school committee. We talk once or twice, every week or every other week, to connect and make sure that we still know what each other are doing.
Yeah, with these ever-changing guidelines, I mean, things are going to be almost to the, August before parents find out if their kids are going to go back to school or not.
Right. We always talk about this, and I think that you guys mentioned it earlier. It's constantly changing the information we get. So hopefully by August, we might know something more, something new, and some more information on the virus that will help us plan better.
Okay,
Wow.
thank you. Thank you.
Well, I know my granddaughter is going to college and they're going to start August 8th, between the 8th and the 19th, and go right through until November. Then they're not going to go to college again until the end of February.
That's
And-
flu season,
Yeah. And then,
right,
you know,
Stace?
but
Yes,
they're still,
That's what I don't understand. I just said it to two people yesterday. This is not flu season. So why is this here? I mean, because it's viral? Because it's a viral and it's not flu season. Why are we here with this? Stace?
Well, it's not flu. It's not flu. It's a different virus, the coronavirus. Yeah, unfortunately, it's just.
And the other thing is you can get flu any time of the year. It doesn't have
Oh,
to
you
be.
can.
Yeah, it doesn't have to be within season. You can get the flu or you can get COVID I'm sure, any time of the year now. And that kind of leads into my question about, do we know, have we set up a clinic date for flu? Do we have that yet or not yet?
Not yet.
Not yet.
Yeah, as we get closer. It's usually, a weekend in October.
Yeah.
Let's talk about things constantly changing. Flu is never the same either.
Yeah, I'm gonna go back to the school. I worry so much about the buses with the kids too. I mean, not so much junior high kids or high school kids, they take instruction, maybe they can understand social distancing, but certainly not K through 5. It's not gonna understand, you can't sit next to me and we can't share that candy bar while we're talking and spitting at each other, I mean, that bothers me that this is gonna happen, or maybe we don't do buses, but that's not our choice. That's maybe our recommendation, right, Scott?
Yeah, we'll work with them to figure out the safest way to do all operations, whether it's classroom, transportation, staff. So I think there's a lot to be discussed with the schools, but I think at this point we're a little bit of a holding pattern to see, how the next couple of months go in. I know they're coming up with a lot of contingency plans because there are so many logistics that go into the school system. I mean, it's huge. And I don't know, what do you mean? If kids don't behave on the bus? I thought that was, kids are perfectly behaved
Yeah.
all the time, right?
And trying to keep them to have masks on might, it's like trying to keep them to have a hat or a scarf or mittens on. They'll stay on for about 5 minutes and then whoop, they're gone, and then we'll have masks all over a bus. So I don't know. I don't envy them that task. That's a big task to try and figure out what they're going to do.
okay, change of subjects here. Sigal, are they going to be taking temperatures tonight at town meeting?
There's not going to be sort of like a screening station. I believe there will be those scanners. It's like an iPad with a screen, and it just takes your temperature from afar. You don't have to. They've really moved away from temperature checks as far as a screening tool because there's so many people that are either asymptomatic or don't have a fever. So it's not a very productive screening tool. They've removed it from the guidance for camps and programs like that. So it's
They're not doing that for camps or no?
no, originally they were, and now they removed it because it's just
Okay.
it doesn't
So
really.
for
How about
restaurants, is that
hairdressers?
still a guideline? Angelo, is that still a guideline for restaurants to take your staff's temperature?
I think
No.
they took it. No.
Okay, so
You don't
hairdressers.
no
No.
longer have to take your,
Now, some places might choose
Oh my
to
God.
go more.
Okay.
It was never a requirement. You could
All right.
you were it was part of a screening question, like do you have a fever? But they never actually were required to take fevers.
Okay.
So there's no reason for restaurants who take to take their staff's temperature anymore and log it in a book so that we would know that they came in with no temperature but left with the temperature.
No, it's not required. What's required is a screening question. So have you been sick? You know, have you had a fever but not actually taking it?
Okay.
Interesting.
And that's again one of those things that's constantly changing. So I know there's a lot of confusion about it out there.
Yeah, I mean, I had so many restaurants that call that, and I thought in the beginning we took the staff's temperature.
I think that wasn't all the guidance at the beginning, and now it's been removed.
Okay, thank you.
Our next point of agenda is our next meetings. Do we want to meet July, August, and September, or do we think we just wait till August because of vacation? What do you think?
If Segal thinks that it's necessary during this COVID time, then yeah, we don't, we can make it instead of every 4 weeks, we can make it every 6 weeks, every month and a half, or we can still meet every month. It's, whatever she feels is necessary. I don't know, with the pools and stuff like that, it's going to be interesting to see how that wears out, how they're going to do the distancing and all that sort of stuff. So I don't know, Segal, you think monthly for the next month?
Yeah, I think the more communications, the better, and as things are constantly changing, I'm to the board, but I think having monthly meetings makes sense.
Okay.
Yeah, I don't mind. So whatever you decide.
All right. So can we pick a date? So Gal, you're on vacation starting next week, correct?
Correct.
And Stacy, you're on vacation.
Last week in July, but it's okay. You can, the gal's the important one. Don't go by me.
Oh, really?
Oh, you're important. You have a lot of input too. So I don't know, what day of the week is better? Monday, Tuesday?
Doesn't make a bit of difference to me.
Doesn't make a difference to me right now. Monday's
Okay.
good for me.
Monday's good.
Is
Monday?
Monday?
Do we want to say the 20th, July 20th
Yeah.
at 10:30?
Yeah, that's okay. That's all right with me, July 20th.
Yeah.
Yeah.
Okay.
And then about August 24th.
These are Mondays, correct?
Yeah.
10:30 on the 24th?
Yep, that's okay with me.
Okay.
That's good for me. 10:30, right?
Yep.
Yep.
Thank
And what
you.
about September? Do we want to make one earlier in September? Because we have Hazardous Waste Day, correct? In September?
Yes, on the 26th.
Well, maybe not.
6. Why not?
Well, we have to discuss how we're gonna interact with these people.
Yeah, but that's why I think maybe in September, we'll make the meeting maybe a little bit earlier in the month so that we can discuss how we're gonna make this work.
Well, I mean, maybe we take Joan's idea and we just space out, we go July 20th and we go to beginning of September and skip the August 24th. What do you think?
Yeah?
Yeah.
Do that, that's okay too.
So like September 7th?
That's Labor Day.
Oh. We could do the.
Oh, we can do a Tuesday that month.
Yeah, we do September 8th. How about you, Carolyn? Is September 8th okay?
Yeah, sure.
And
10:30?
we'll go 10:30 and we'll cancel out August's meeting. That way we'll have,
We're gonna
we'll-
cancel out the 24th. I'm trying to write it
Yeah.
all down. All right.
yeah. That way we'll be
Fine.
early for hazardous waste, we can decide if we're gonna be able to do it. And if we're not gonna be able to do it, we give enough notice to the community that it's not gonna happen. Although I think they're really looking forward to it happening because we didn't have May, so. But we'll see. We'll see what we can come up with.
I would like for the month of August to stay kind of active with Segal and Stacy as a board member to know what's going on with the schools, Segal, so that, you know, we can stay updated on that for the parents if we see them.
Yeah, for sure. Okay.
Yeah, I mean, it's just a hard time for all of them. I mean, they do come up and say, well, what do you think? You know, and we say the same thing, guidelines change from 9 o'clock in the morning to 5 o'clock at night. It's just not gonna work for them in August when we say that they need to have some kind of commitment. But, and it's still hard to do. It's still very hard to do.
Well,
So you
do
want
wanna
to, one
have them-
for mid,
just to have discussion on that topic only?
No, I mean, I pick up the phone and call Segal and Stacy. I just want to stay active with our, you know, emails and stuff about it. That's all.
Saying it could be something giving community information on that date as well that we know of by school, you know. We could make it a 10:30 meeting and just have it a quick meeting to discuss what's going on with the schools so that the community is aware of what's going on.
But will they know?
Well, yeah, I would want that to come from the schools and the superintendent. I think we're more of a consultation on those. And we, you know, we
Okay.
make group decisions and we discuss them, but I think all announcements should come from the schools.
Okay,
Absolutely. Okay, so let's leave it for July 20th and September 8th.
yeah,
Okay.
and if something comes up in July that we feel that we should have a meeting in August, then we can do that.
Of course.
All right, Carolyn? You know,
I'm
if
fine
there's
with
any,
that.
you know, if there's any questions about busing in schools and things like that, then we can meet in August for a brief time and just use that as the only thing that we're gonna play with.
No, I just
Right.
want to make sure our administrators, Segal and Stacy, are very much involved with that, to guide them through the school.
Yeah.
The
Oh,
school
I'm sure
committee
they
and the
will.
superintendent through all
I'm sure-
that.
Yeah, no, I'm sure they will.
Yes, and they've been great
Thank you.
partners in this.
Okay,
Like to make a motion that we adjourn? Is
I
that-
second that.
all in favor?
Aye.
Aye.
Aye. Meeting-
Yes.
Aye.
Aye.
Enjoy this lovely weather.